Okay, everybody should be seeing my screen right now. Let me move this off to the side for me. Okay, so again, my name is James Norton. I'm one of the sales directors here at Pinnacle Financial Services. Just wanted to introduce myself. We have three teams here. If you already deal with us, you may know we all have different territories. We're all split up by East Coast, Central, and West Coast states. So today, a little bit of housekeeping information. We're going to kind of go into a little bit with the Medicare basics. Maybe not, not so much dive into the nitty gritty details of A and B. We're going to do kind of a light coverage of that, but then also kind of enrollment periods, different things like that when you can enroll your clients, and then also talk about some of our tools at the end. So we'll show you how some of these tools are going to kind of be able to assist you. But everybody is on mute, and as I go through these things, you do have a question box. We're getting a lot of questions at once. I'll stop and try and address them. There's a lot of stuff I want to try and cover also. So that's the only problem is, if there's too much, we can get a list. We can kind of dish it out to all the marketers who handle your state, and they can kind of give you a call and answer any questions you might have. So Medicare basics. Let me switch over here. All right, so the agenda as we covered again. So Medicare Part A and B versus the privately owned plan. So Medicare, the government versus the privately owned, basically. Plans you want to rule out or include. There's certain plans that you might have to put together, or some ones you have to sell separate. And then also at the end, I know it's going to run a little bit close with time, but we're going to go over tools of the trade to some of those quoting software and other things that we do offer. Okay. Now everyone can see my screen, correct? I just had something pop up on the laptop. Just want to make sure. All right, I don't see anything that people aren't able to see, so. All right, apologies for that. I didn't realize that looks like my mouse wasn't working there. It didn't click the start broadcast. So we'll run through this again really quick. My name is James Norton. I'm one of the sales directors here in the Medicare team at Pinnacle Financial Services. If you are aware about kind of what we offer, we're an FMO, NMO, NMA, IMO. There's all different acronyms for all the different carriers, just in terms of what contract level you have is all it really means. Essentially, with all those terms, mean we're the top of hierarchy, or we have the highest contract with each of those. So if you have an MGA, SGA, whatever your agency size is, we can offer contract levels for all those different sizes. Basically we're the top of hierarchy is what it comes down to. So now into what we're covering today is the Medicare basics. So basically, as you might have saw in there, we're going to go over a difference between MedSup versus Med Advantage. We're probably going to be touching that on the most in detail. Not so much going into A and B and the coverage amounts of A and B and those different things and the government-owned plans. We will just talk about which ones are government-owned and which ones are privately owned, and then also which ones you automatically receive with Medicare, and also versus ones that are optional. So again, Medicare basics. So agenda, again, Medicare Part A and B are government supplied plans versus privately owned plans we'll get into. Plans you're going to either include and sell together, or rule out, I should say, and sell them by themselves. And then also at the end, I do want to touch on tools of the trade. So depending on how many questions we get and things like that, we might be able to rock through some of the beginner, kind of Medicare things, depending on what level of people are on the webinar. I should say level of knowledge of people on the webinar. But then also what we're also going to cover is kind of the quoting software, online enrollment tool as well. So we're going to go over everything that we provide you that's going to make these type of sales and kind of your everyday process a lot easier. The biggest thing with that's probably going to be our online enrollment software. It's connectformedicare.com. If you're not familiar with it already, we've been talking about it a lot. We had it last AEP. We were one of the top agencies in terms of production through that platform. So we were one of the best at promoting it. I think we had about 3,000 apps submitted through there. Basically, to give you a quick thumbnail overview before we get into detail later on it, it's both an agent and client-facing website. So you can have a personal URL that's attached directly to your NPN, only showing the carriers that you are ready to sell through us for. And you can put that on your website. Clients can run their own quotes. They can put in the drugs that they use, which pharmacies they prefer. They can do doctor lookups. It'll spit out what the best plan is, and then they can enroll themselves. Same company made Medicare.gov. It's very similar. I think it's probably a little bit easier to use than the Medicare.gov as well. But we will go over that at the end, and we do have separate webinars as well. So if you don't have time later on, just let me know, and I can try and send you a recorded copy of just the webinar walkthrough. But I want to just kind of use it in, as an example after we talk about the differences in these plans, and then kind of just show you the best way you can use it. And again, you can always use that as an agent as well. Run all these quotes, send the scope of appointment, and then just send the enrollment documents over to your clients. So moving forward, here we go. First is the 4 parts of Medicare. So if you're familiar with it already, there's Part A, Part B, Part C, and Part D. As you can see, there's kind of a logo with each one to kind of give you a little representation of what each will offer you coverage for. All right, so Part A is going to be inpatient hospital, skilled nursing, hospice care, home health care. Really anything to do with the hospital is going to be really what's under Part A. And Part A is going to be supplied by the government. It's actually activated just by signing up for Medicare. So it's not something where you have an option of whether or not you want to go on it and when. So like I said, or I'm sorry, you do have a say over when. But essentially, yeah, so you'll get this right away. It doesn't cover everything with those. I know I've talked about this with agents before, and they kind of got a little bit confused. So it says inpatient hospital stay, skilled nursing, hospice care. But if you looked on Medicare Advantage plan details, you'll see all those things listed and how they have different coverage amounts. So this doesn't mean that it covers it, completely, so you don't pay anything at all, but it offers some coverage. And then we'll kind of get into how the other plans, play into that as well. So the things listed here are just some of the general terms of coverage that you do get, but again, it is not it's not fully covered with which each of these things means here. So Part B is going to be more so the doctors. So clinical research, you can have ambulance rides, durable medical equipment, certain mental health issues, second opinions before you get surgery, also some physicals, so blood pressure tests. Things like that, heart rate, whatever you can imagine that you go on physicals for, that's what Part B offers some coverage for. And Part B is actually optional coverage as well. Or not as well, I said it is hospital coverage. So try not to fly through this really quick. Type anything out. I know I deal with this every day, so sometimes I don't think about a certain topic. It might seem simple to me, but for somebody that's brand new to, don't feel bad to type in the question box there. It is private. So no one else will see your questions. So, go ahead and if you want me to ask them, or I should say answer them separately, I'll give you a call and just let me know, and that's fine as well. So that question box is there. So if you want to try using it as well, I got a couple questions on here just to kind of keep you guys engaged and see if if you have any questions, or if you want to throw some answers out there, make sure everyone's awake. So first things first. So Medicare Part C, also known as, I don't know if anyone knows this already, you can kind of type it in. It's a pretty known type of coverage. There we go. We got one already. MAPD. Oh, sorry, I keep clicking this question box instead of the PowerPoint. So yeah, Medicare Advantage. MAPD or MA, correct, John. So basically, there's 2 options with those. As you can see below, it combines both A and B. And added some extra benefits. John or anyone else, do you guys know what some of those extra benefits may be? Not going to be in every single Medicare Advantage plan, but some do offer. More popular, you'll probably see in dual SNP plans and things like that. Yep, there you go, John, again. So you'll have dental, vision, and or hearing. This isn't in every single plan. It's going to be kind of spread apart, and depending on which area. Yeah, John's saying gym memberships as well. The dual SNP plans I'm not getting into. Those are for your LIS and low, Medicaid clients, really low income, and those will have one-way transportation. They'll have, like I said, gym memberships. They'll have dental, vision, and hearing, all different types of things. So Part C is really where the agent comes into play. You're selling Part C, Medicare Advantage. Obviously, it's really big during AP and the end of the year. But we'll kind of get into some of those things a little bit later. So next plan is Part D, and if you can guess it by the picture there, it has to do with your drug plan. They're sold in different tiers, different plans at different tiers. It's not kind of structured the same all throughout the country. It's the same thing with Medicare Advantage. So Medicare Advantage isn't going to be the same plan that is sold in Pennsylvania. It's the same coverage in Texas. They're going to be completely different. There's a lot more work, I would say, that goes into a Medicare Advantage sale. You have to look up doctor networks. You got to look up, different tiers of drugs. The drugs come into play as well. And then also you got to kind of just look at the different copays. So you'll have different ones, different copays for inpatient hospital. There's additional plans you can kind of add on based on that. So there's really a lot you can get into. When I show you guys the Connect for Medicare, the online enrollment platform, you actually see how it takes a lot of that work out of play for you. Medicare Part D is one of the plans you actually can pair with another type of plan that actually we're going to talk about next. I'm sure some of you guys might know it, and that's going to be Medicare supplements. So if you watch Medicare.gov, or a really great video series that I've watched when I first started, was just going on YouTube. And if you actually look up Medicare Made Clear, I'm a visual learner, so I think that was the best way I was able to pick it up. It's kind of similar to how this PowerPoint's laid out. They do explain, each part of Medicare more in depth. They have probably about 10 videos that can go about anywhere from 20 minutes to 40 minutes to an hour on each topic. But it really will dive in and kind of give you a breakdown on each one of those. So if there's something, some part of Medicare or a certain plan that really gives you any confusion, obviously you can ask us. If it's a Sunday night, later on, during the weekend, sometime we're not around, we have some of that stuff on our website. I'll show you later, but go on YouTube and type in Medicare Made Clear, and they have a bunch of great videos. Kind of looks like you're looking at a whiteboard. They draw everything out for you, so that's why I say it worked really well for me as a visual learner. So MedSups or Medigap plans. They're not really coded under a certain letter. They're called Medigap on Medicare Made Clear, and some of these basic and initial videos when you start learning about the different Medicare products. So a lot of times you'll see Medigap, and then someone will throw out MedSup, and they'll be like, "Well, wait, what's MedSup?" They might not know. So MedSup and Medigap are the same thing, or the same thing. It's going to be universal coverage with different plan options. So for MedSups, it's the same coverage nationwide. Now there is some states that have weird little rules with that. I believe New York and Minnesota aren't my states, but I believe those are two that kind of have different rules when it comes to those products. So if you do have any questions about those, go in the chat box, throw it in there, and I'll have one of the marketers from those territories reach out to you. But you can have, they're basically split up by letters in the alphabet. So you have A, B, C, and not to confuse that with, Medicare's Part A and B, but there's some of the different plans. The real popular ones that you're going to come across are really F, G, and N. Those are our three most popular plans, and the same coverage in Pennsylvania for Plan G is the same coverage in Texas for Plan G. So it's a lot easier to learn the MedSup plans first. You don't have to do any AHIP certifications. I should have backed up and kind of talked about that, but the only products you need to sell for, the only products you need to certify for, by taking the AHIP is going to be Medicare Advantage and prescription drug plans. MedSup, all you need is your life and health license. I think I run across that a lot when I talk to these agents who are newer to Medicare. Their biggest, quarrel with Medicare, why they don't want to sell it, is because you have to do certifications, and they hear the horror stories about AHIP. That's really not the case if you just want to wear MedSups, or just want to sell MedSups, not wear them. And we can get you set up right away. And moving on here. So you're going to typically experience higher premiums. These are actually going to be, give you more peace of mind because there's more coverage. Plan F was originally the Cadillac plan, they called it. That covered everything. So if you paid for a Plan F, might have been, depending on the area, there's different rates in different states and depending on different carriers. So that's where you really got to do the comparisons, and I'll show you that later on our quoting software. But if you can pay the 150 or 120, 130, depending on your age and male or female, and then also if you smoke or not, depending if you have to get asked some of those questions, That's going to determine what the premium is going to be. So if you can afford that, for example, Plan F before would cover everything. So hospital, doctors, it would cover everything except for drugs. You wouldn't have to worry about a single copay when you're on a Plan F. So in terms of marketing, you can throw this in the chat box as well. If you're going to do some of our lead programs that I can kind of inform you guys about briefly when we go to the website, do you know what income levels you might want to target when it comes to med sup plans? Like I said, you're going to experience higher premiums, $100, $90. Basically, you guys want to go after the higher income type clients. I generally talked a lot about this with some of my agents or agencies who are really big in the annuity world, even some life products. They already have a bunch of clientele that's higher income, and they're going to be more likely to be able to sell on a Medicare supplement plan and kind of afford those products. So basically, and Mark, yeah, I see your question there about Plan F. That's actually my next slide, so we'll get to that. Yeah, so basically, with marketing, higher income type clients, you want to look at those that they're going to be able to afford paying $120, maybe sometimes even $150, a month for these plans, and they'll offer better coverage. You don't have to go through and see what doctors in network. You don't have to see what the inpatient, hospital copay is. You don't have to see, how much they're going to be paying every time they go to a physician or a specialist. Everything will be covered, and you offer your clients peace of mind. Now, as I mentioned before, there's different plans. Now, Plan F was the Cadillac plan previously. Now, I saw Mark throw a question there about Plan F. Does anyone know what's happening in 2020 with Plan F? I'll give you guys a couple minutes to answer that. And as you do that, I'll kind of explain some of the differences. Plan F will have the best coverage. Plan G is kind of a step down. Plan N is a step down from that. So you can kind of lower coverage, and a lot of I see agents doing that are because they want to free up some premium space to cross-sell them maybe a life or annuity, or something along that nature. Eugene hit it on. So basically, in a shortened term, you can just say macro. Plan F will no longer be available and eligible for. So Plan F no longer available for Medicare eligibles after 2020. So as you can see in my little PowerPoint or my little points down here, Plan F is still available. So it's not, if you reread the title, Plan F is no longer available for Medicare eligibles after 2020. So if you have somebody who's Medicare eligible right now, you can still put them on a Plan F. It doesn't completely go away, but as of anyone who, January 1st, 2020 and beyond, if they do become eligible for Medicare, you will not be able to write them a Plan F. Exactly. Yeah, William or Bill Levine, there you go. You got that. Yeah, I see someone, I might have briefly touched on this before. I see someone asking about sending the recording. So this will be recorded. So if you have any questions or you missed anything, just let me know and we can send this recording out to you. Even if you want to have the conversation with me one-on-one, I'd be more than happy to do that. Sometimes I prefer doing that than someone re-listening to a webinar. But so again, to get back to it, if you are Medicare eligible after 2020, you can no longer be on a Plan F, but those who are on or are available now will be able to offer it. So Eugene, I see you jumping out ahead of me on my slides already. Next slide here. So what's the difference to go from a Plan F to a Plan G? Like I said, Eugene just threw the amount out there. But does anybody know the exact amount and the difference in coverage? And I got that. I can send that to you. I got your email there. So kind of to rewind a little bit, the difference from F to G is the Part B deductible. So what I'm asking about is the actual amount. So the Part B deductible is supposed to be a transition slide and not show up in there right away, but give you guys a little hint already. So do you know what the amount is? And that's actually going to be $185. We will go over this on our quoting software, but I think the best way to kind of show the difference is doing a little side-by-side comparison and throwing that number up there. Typically, from my experience, what I find the difference in premiums, annual premiums is between F and G is about $300. So John, a little bit off. I see you say $150, but it's $185 and it stops at that. Yeah, and I will get that Ellen as well. With G being a guarantee issue, you guys are throwing out a lot of good information. But the difference for 2019, the difference from F to G is you have to just pay your Part B deductible at $185. So once you hit that deductible, your client will pay no more money. Now, people who are kind of, I would say, in the know are pretty experienced when it comes to med sub products. I have actually been selling Plan Gs over Plan F for a long time now. Now, there's only one carrier that we'll throw this one up there for more experienced agents. Do you guys know which carrier, at least for some of my states that I handle, that will actually offer a guarantee issue Plan G? And there's only one carrier that I know of right now moving forward. So before, if you were, guarantee issue, you can only get on a Plan F for some of these other plans. Let's see, we got a little response here. Yep, Lenore, you got it right. And John as well. AARP, which is United Healthcare, is the only company that will actually offer a guarantee issue Plan G as of 2019. But in 2020, that is going to be changing, and Plan Gs will be are going to become guarantee issue. But from what I've read, I've looked in a couple articles, and they're saying over the next 5 or 6 years that it's expected to only go up to about $217. So I think a lot of people were kind of expecting more of a raise than that. So I think that's good news. Next 7 years, it usually goes up only maybe $2 or $3 a year. Last year was about $183. So in the next 7 years, for it only going up to $217 is pretty good. Okay, now moving forward. So enrollment period. So you're going to have the initial enrollment period where you get into the plans. That's aging in. You could have the drop in your employer coverage, whatever it might be. Not really get into those as much. We have other webinars where we kind of dive deep into those. Then you have your SEPs, special election periods. So that could be, anything happen from moving to losing credible coverage. There's a couple other in between details as well. So underwriting. So there's certain plans you have to go through underwriting, and that's actually going to be your med sub plans typically. Also, you have AEP and OEP. Now, first thing I'm noticing, I actually just copied and pasted this in this calendar up here. Is you have OEP and AEP are two different things. So this is actually kind of confusing. I wouldn't actually ever use this image again because it shows October 15th all the way to January 15th. I'm not sure why I put it up there. That's my mistake, to be honest. I saw it and I just copied and pasted it and threw it up there. So AEP is annual enrollment period. That's what's been around for the past, however many years. And I'll get into which products those deal with, but that's going to be from October 15th to December 7th. Again, I'm sorry that that chart up there, the Google image I threw up there is actually a little bit off. OEP is going to be where you can change, Medicare Advantage or PDP plans. We'll get into that a little bit. And OEP is open enrollment period, and that's actually from January to March. And that's actually going to be when you have a Medicare Advantage plan and you need to have a one-time change. You have that option, and that was new for this time for 2019, I should say. Yeah, I see some when you guys call me out about the chart. I know I realized that as soon as I saw it on the big screen. When I did it on the laptop, I was kind of making sure everything was together. I didn't think twice about it. So apologies for that. So med subs, you can outside of SEPs and initial enrollment periods. There are some certain states, like Oregon's one of my states, for example, where you have a birthday rule. And on that birthday rule, basically each time when you enrolled, every time at the year, the time you did enroll that month, you get a chance to relook at your med sub plans, and they're actually a little bit more expensive there for that reason. So I'm going to explain that a little bit confusing. So it's a birthday rule in Oregon. Every year around your birthday, you get a chance to reevaluate plans and pick and choose which one you want to go through or go into without having to go through underwriting. AEP and OEP do not affect Medicare supplements at all. The only way that it could somehow affect the med sub is if you decided during this time period that you wanted to discontinue your Medicare Advantage plan and you wanted to get into a med sub plan. But you still have to go through underwriting, so it doesn't change in terms of your enrollment period or your enrollment time. AEP and OEP does not affect that at all. Medicare Advantage and PDPs. So both Medicare Advantage and PDPs can be chosen or switched during your not switched. I'm sorry, can be chosen during your initial enrollment period, or if you qualify for some type of SEP. And both do not have underwriting because you can only choose them during a enrollment period. AEP is the only time that you can switch both Medicare Advantage and PDPs however many times you want. So that could be, kind of bad news for as an agent. But basically during AEP, the last application is the last one that will remain active. If you're on a Medicare Advantage plan and you want to switch to an MAPD, or I'm sorry, sorry to confuse you. If you're on a Medicare Advantage plan and you want to switch to a MedSup and a PDP, then you can do so by disenrolling, and you disenroll to a Medicare Advantage plan by enrolling at PDP. Now, I'll repeat that one more time. Medicare Advantage plans and PDP plans will cancel each other out. So if you're on a Medicare Advantage and you roll into a PDP, whenever that PDP comes into effect, it will automatically cancel out the Medicare Advantage plan. And likewise for Medicare or for PDPs to MA. So if you're on a MedSup and a PDP plan and you get on a Medicare Advantage plan, when that Medicare Advantage plan becomes active, it will cancel out your PDP plan. But that does not work for Medicare supplement plans. Medicare supplement plans you need to call and cancel. But when you do that, say for example you were switching to a MedSup to a MedSup, I would strongly recommend you waiting until your client has been accepted on that new plan before you call and cancel from their current provider. Have them call and cancel. You don't want to have them call in and cancel their current MedSup plan because you're going to enroll them on this cheap new plan that you figured out, or you quoted them, and then you go to enroll her and then she ends up getting denied, and then she has no coverage. Maybe she has some health condition that's going to constantly get her denied, and now she has no coverage and she has to maybe wait till AEP to switch to a Medicare Advantage plan. So you need to be careful of that. So we got a question here. Okay. Not a Okay, so I have a question here. If you're on an MA plan, not a MAPD, enrolling in a PDP will not automatically kick them off the MA plan, correct? So this could be different, Ellen. I'm not sure which state you work in, but in mine, you can't be on a PDP and an MA plan only. So there's these to kind of fill everyone else in. There's these Medicare Advantage plans that only offer the hospital and the doctor coverage, and they don't offer any drug benefits at all. But these plans are usually geared towards veterans who already have some type of drug coverage. Okay, so Ellen, that might be the case in Nebraska. I actually don't have that state, so I apologize if I'm kind of telling you the wrong thing. But 9 times out of 10, you cannot be on an MA plan and a PDP plan. You can only be on one or the other. So if you find a really good MA plan that has great benefits for the doctors and the hospitals and everything, but no drug coverage, you cannot write them a PDP. I'll have one of our marketers reach out and kind of answer that for you, Nebraska specific. But for most of the states, that is the case. So SEP, now SEP is the one time you have a chance to switch your plans, but you only qualify for SEP if you were on a Medicare Advantage plan. So let me make sure I'm explaining this carefully. So if you were on a Medicare Advantage plan, you have one of 2 options. Really, one of 3 options, I should say. So you can switch to another Medicare Advantage plan one time only and use it during that time period, which is January to March. January to March. Or you can disenroll from your Medicare Advantage plan and switch to a PDP and go on original Medicare and PDP. So let me say that again. Only from Medicare Advantage to PDP. You cannot go from PDP to MA. So if you're on any type of prescription drug plan, you cannot switch. Or I'm sorry, if your client is on any type of a prescription drug plan, they cannot switch. So only if you have a Medicare Advantage plan can you disenroll, go on original Medicare, and then enroll in a PDP. And then also what you can obviously do after that is also trying to get them on a MedSup as well. And then by putting them on MedSup, you have to go through underwriting and all that, and that's a whole nother process. But you can only switch, or use the oh, you know what? I'm sorry, I put this wrong thing. I meant to put OEP here. I apologize. Right. So this is supposed to be OEP. I'm sorry. So OEP is a one-time switch and only happens if you're on Medicare Advantage only. So again, OEP January to March, and that's going to be Medicare Advantage to a Medicare Advantage one time, or that's going to be Medicare Advantage to original Medicare and a PDP. Apologize for that. I mistyped that. So that should be OEP, not SEP. So that's actually it for the presentation. So let me go back. I'm going to pull up our website now. Like I said, I'm going to cover some of the tools. Before I switch off of the PowerPoints, though, does anyone have any questions or anything at all? Again, that last slide was supposed to be OEP. So OEP is your one-time switch, January to March. Let me pull up the question box here. All right, looks like that was it. All right, so I'm going to jump over to some of the tools of the trade that we offer. So if you guys are contracted already, you might already have a login to our webpage. But what we actually do is we give generic logins out. So that'll be good for each week, basically, and let you kind of go on, check out some of our webpage, and kind of play around, navigate it. You can use our Medicare quoting software. So we actually have CSG is our quoting platform that we use, and then our online enrollment platform, and I'll show you briefly, is right here, Connect for Medicare. Now, this one we don't give guest logins for. You actually have to be contracted and ready to sell in order to use this, because this is a platform in which you're enrolling people. So you can't just give out, you can't have people running these different type of quotes and using the enrollment. But we do have recorded webinars when we do this. And if you have a certain marketer that you deal with, they'll actually give you kind of a walkthrough for each of the tools on here, and kind of run you step by step and kind of give you a one-on-one experience. So pfsinsurance.com, that's P as in Paul, F as in Frank, S as in Sam, as in for Pinnacle Financial Services, and then the word insurance.com. So this is our home platform here. We also have webinars where we go through the whole website. I'm not going to do that here just for time purposes. It might take maybe 45 minutes or so. I'll just show you a couple of things here. So we got our products, Medicare. Show you some of the generic information here. Medicare Part A, B, C, and D kind of gives you a breakdown. AEP certification info, so it can show you the links on where to go and how to certify for 2020. Most of the certifications are out. AHIP is out, and we're doing calls actively from our support team. So if you're contracted with us already and haven't completed your 2020 certifications for any of the carriers, we're just giving you some friendly reminders that you need to do so. So there's just some of the Medicare, the AEP toolkit. And here's a sneak peek. So if you are actually contracted and ready to sell with us for each of these carriers, or even one of the carriers, you actually get a password that changes each day, and you can log in here. You can click on the carrier, put in the password, and you can see the new plans that have came out, or that came out for 2020. If you're interested, give us a call. We can kind of give you a little bit of a hint of where it might be competitive, and kind of where we can get you an opportunity, and hopefully writing some business for AEP. And for those of you who aren't familiar with the sneak peeks and what they are, so basically each year Medicare Advantage plans and PDP plans will actually switch their benefits, their premiums. They could be rolling out brand new plans. They could be doing a service area reduction, or SAR, where they're removing plans from certain counties, and then some of your clients will actually need to be written on different plans. So it's really important for agents to do a lot of their business during AEP, because this is really where you're finding out your business model and your marketing strategies and everything that you're going to be doing for the upcoming year, and where your opportunities are. And as marketers, I mean, that's kind of our job to help you out with that as well. So don't be afraid to call in. But we're going to go to our quoting. That's kind of what we talked about, tools of the trade that we do offer. So I'll quickly do a med sup. This is actually a webinar for our CSG quoting software is what we use. So I'm going to go to Medicare quoting tool. And as this loads up, here we go, med sup. And I'm just going to use one of the zip codes here, 19040. We're actually located right outside of Philadelphia in Pennsylvania. And another great tool that we probably won't have time to kind of cover on here because I do want to hit the online enrollment platform. But we do a great side-by-side comparison and cross-selling for Medicare Advantage to hospital indemnity plans. So basically that just has to do with your inpatient hospital stay. If it's too much, I'm throwing at you right now because we're covering the basics. Just give us a call and we can kind of fill you in on what those are and kind of show you how to do the cross-selling and what to do your scope of appointment. And we do some of the webinars that do cover that. And if you've been in any of our meetings actually that we've done in the different areas all throughout the country, we always do the side-by-side comparison with the hospital indemnity to Medicare Advantage plan. All right, so here's a med sup quote that we're going to be running. So we have a 65-year-old female, is non-tobacco, non-smoker, Plan F, and then you have the effective date here. Doesn't matter as much for med sup. I mean, if you're quoting now and you're going to be writing somebody in 7 months later, yeah, the prices could change, but generally, can they change in a month? Yes, but more times than not, it's pretty much the same. So our quoting software will actually list each carrier that we offer appointments with. So if you're running a quote and you're with one or two companies and you see a new carrier that's really competitive for the case that you're running and you've never heard of them or you're not appointed with them, just give us a call and we can get you enrolled. Once you fill out our one-time contract as well, you won't have to fill that out again. So say you see Lumico here is competitive and you want to get appointed, just send us an email. All we need is something in writing and we'll get you set up. So again, this is listing in order from cheapest premium to most expensive. And the great thing about med sups is when you pick a Plan F, all these are Plan F. All of these are offering the same coverage. So you really don't have to go through and once you find the cheaper premium, you don't have to worry about, okay, well, does this one have a doctor in network? Does this one have what's their drug formulary looking like? Are they offering cheaper drugs, drug coverage than this other plan that's more expensive? So you don't have to really worry about all those headaches. You just really quote and make sure they're okay with that carrier, and then you can enroll them. And I say make sure they're okay with the carrier because sometimes you just run across people who have had a bad taste with a certain company. They might not want to get enrolled with them. We hear about it all the time. So here's your Lumico. So what we're going to do is actually run a side-by-side comparison. If you click on this green bar, you actually can add it up here, and it'll start to through all these companies, and you can do the side-by-side comparison. And it doesn't have to be the same, under the same demographics. You can do two quotes under 65 female, and then you can do 65-year-old male and do another two quotes. It will add up to 5 carriers. So what we'll do is we'll add Aetna Med Sup on Continental Life, and then we're going to add just a Plan G and a Plan F, and we're going to talk about that Part B deductible we were hitting on earlier. But I just want to show you a couple of these cool tools in the sidebar. So applied discounts is on here. That'll be if there is you have a household discount listed here, and 9 times out of 10 with all the carriers, you qualify for the household discount if you are both living in the same house and under the same company's med sup plan. So if you're both on Continental Life med sup, you're going to qualify for it. If you have a husband who is 70, he's been on Aetna Med Sup for 5 years. Now the wife's aging in. She's getting on it. Both of them will get a reduction in their premium. And so if you want to compute that already, put in applied discounts. Another reason you do just want to give us a call if there's some carriers you're not as familiar with. A lot of times you can just pull up this PDF application and you can look up what constitutes a household discount. But a lot of times, or I shouldn't say a lot of times, but a couple carriers will actually offer household discounts if you live with someone 18 years or older. So you can just go in here, Control F, and hit household discount, and it'll give you actually all the information of what happens when they do qualify for a household discount. They could be different from carrier to carrier. But that's just a little Control F or the Control Find key I hit. shoot, you know what? I'm sorry. I just backed out of the quote. Let me just get back on here. 19040. Apologize about that. Okay, so I see you guys are saying it's a little bit hard to kind of see the screen, so I'll zoom in a little bit for you guys. So here you can see the parent group. This is the quote we ran: 65 female non-tobacco plan F, and that's the zip code we used. Some of the tools we were talking about over here: apply discounts will show the discounted rate if they qualify for the household discount. Annual rate obviously will show the annual rate. But when you actually do the side-by-side comparison, it'll show all of that information on there. Market analytics is actually a really cool tool I like to use. So market analytics will actually show you what type of increase they're going to experience in the next 4 years. And then also in some areas, it'll show you the type of increase history they've had. So like Medicare Advantage, they have the changes every year, but that's always January 1st. They'll have some type of plan changes. It's different for MedSup in the way that in different time periods throughout the year, they have the option to kind of raise and lower their rates. But usually they do, every year, whatever time that is. And usually, let's see here for Continental Life, they did it in February of 2018, and they didn't do anything again until June of 2019 of this year. But these companies like this maybe keep it all around the same time period. So for Humana, they had a change in 2012 in September, but then ever since, I guess maybe these 4 or 5 years, they kind of kept it around the February, April mark. It looks like in 2018 they had a decrease in August. So it's not always the same time of the year, but generally each year they will have an increase or decrease. And this is also will differ from Plan G to F to N and all those. So just because here it shows in basically 2 months ago they had a 9% increase, doesn't mean it's the same thing for their Plan G. They could have had a decrease 5 months ago for their Plan G. You never know. But this will actually list over the past couple of years, and not all companies display the information, but that's because Lumico's years in the market is 1, so they're new, so they don't have any information here available. But there is some plans that have been available for a long time who actually won't show that information. All right. So you can see has on average a 4.5% increase each year. You can see this company for Humana. They've increased a lot. They decreased a bunch last year. So they average a 0.3% response. You can kind of go through and see. And then also on this side, you can see the increase they're going to see as they age. So yeah, it's a really cheap turn 65 rate, but how much are they going to be going up each year? So this one's going up 3.2% each year, pretty consistent. This plan, you're not going to see any, the Continental Life, you're not going to see any increase until they turn 68, unless they choose to raise the rates over here. So unclick market analytics. The last tool I do want to show you over here, again, if you don't have any type of enrollment period and you need to switch your MedSup plan, you have to go through underwriting. So, some of the underwriting questions pretty generic. There's certain diseases across the board or health issues that will just deny you for all carriers. But if you have something that you want to kind of see if you can get through, you can actually go over here and say, okay, maybe they have AFib, right? And you want to see what plan you can get them on, if you can get them on anyone. And it'll actually tell you the look back period. So here's a 2-year look back for Lumico. Continental Life offers a 3-year look back. So Humana doesn't even have it on the application. So if you have AFib, it's not going to affect your rate at all. And you can get them on Humana pretty easily if it happened within the past 2 or 3 years. But if it happened longer ago than that, then you can get them on the Aetna or Lumico plan. So that's a cool little tool I just want to show you guys. So we're going to click on this plan F for 173. I just want to show you kind of if you have maybe a client who's new to Medicare and they don't know the difference, or they're just starting to understand the differences between F and G, and they want to go with the plan F because they understand that that's the best coverage. And in hindsight, that might be better for you because you might get paid a little bit more commissions because it'll be of a higher premium. But as insurance agents, hopefully your main purpose, what your goal is to save your clients more money. So you want to show them why, whereas a Plan F might seem better because it has more coverage, why Plan G will actually save them more money. So again, you can see the rates here for 129 versus 173 is really the difference. So we're just going to go to compare quotes. And so you can show them if you actually, and you can actually print this out. We're a little bit zoomed in so you can't see it, but there is a print logo over here and a PDF, or a PDF logo here and a print logo here, and you can print this out or save it. But you can look this up and say, okay, for your monthly rate, if you want to go on a Plan F, will be $173. Let's round it up to 174. And if you're on this Plan G, you're about paying $129 a month. And so you go down here to the annual rate, and you look at the end of the year, if we enroll you in this plan, what are you going to be paying on both? So the annual rate here is about $2,000, a little bit closer to $2,100, and this is about right in the middle of $1,500, but we'll just leave it at $1,500. And you kind of compare it, and if you want to print this out, I mean, the only difference in coverage for this year is $185 in the Part B deductible. So all you do here is, add $185 onto here, and you obviously show that this is going to be a much cheaper plan than enrolling your client on a Plan F. Again, some people have enough money, so they just want to get on a Plan F. They don't want to worry about paying anything at all. They don't want to have to pay the $185. If they're fine with paying $173 a month, it's fine. Let them do that. And like I said, a lot of times, because it's a percentage amount, you'll probably get paid a little bit more money. But this is the best way I can really show you, or really if you want to explain to your clients how to save them the most amount of money. And this might actually, prove to work for someone who wants to cross-sell, some life products, or maybe you could sell final expense, or maybe an annuity, and you need to free up as much, monthly premium as possible. You could show them a Plan F, Plan G, or even a Plan N if you wanted to, and that's a little bit less coverage as well. And you can kind of print this sheet out and then just explain what the differences in coverage is. And obviously here they'll be saving probably about $300 at the end of the year if they enroll in a Plan G and they do end up paying their full deductible at $185. Just one other thing you do want to keep in mind though is this policy fee, so you might want to add that into the price as well. But some of the other things listed here is the annual discounted rate, annual rate which we covered, and then the monthly discount rate. So these two will be if they qualify for the household discount. That would be what they'd pay. So I know I kind of probably ran through this a little quick. Any questions on the Plan F versus G or the MedSup quoting? Next, we're going to try and jump to the online enrollment really quick and hit on that, and then we can finish up. All right, so no questions it looks like. We're going to go to our Connect for Medicare. So this is going to be pretty simple or pretty similar to running a Medicare.gov quote. And then log in. All right, so here we are. Here's our home dashboard. Here's what's going to tell us what type of enrollments we've completed, enrollment by plan type, PDP. Here, I'll scroll in so you guys can do this. It messed up the function of it here just because we zoomed in too much. But completed enrollments, MAPD versus PDP. Is enrollments by plan type. So it looks like you got 1 Medigap or MedSup, 2 MAPD, and 3 PDPs. And it'll give you the percentage of plans completed and what type of plan it was, all the kind of generic information. But if you're kind of starting one like we are, we go up to start a consultation. So we'll go here. Let's put Shonda Joe Smith. Actually, date of birth. 1/1/50. Keep the same zip code here, 19040. I'll try and get through this as quickly as possible for you guys. Get you out of here. Okay, this doesn't like to work. Sorry, my keyboard is messing up on me. All right, we'll do Montgomery. submit. So this information here is actually not required. So put in zeros. It's not required, but I'm just going to include it just so that you can see when we actually get to the application, it will actually auto-populate all the information you put on here into the actual enrollment, or the application, I should say. Email is important to put in because when you go to send the electronic scope of appointment or even the enrollment information, we'll actually have with the enrollment information, we'll actually be able to send that right out to them, and I'll show you how you do that. I'll put our office address here. Actually, it's Warminster. Pennsylvania. And continue. All right, so this is the first. We made the profile. Next is the scope of appointment. So you're actually able to send the scope of appointments electronically now, which is definitely a new thing that agents have the opportunity to do. So we can just send that out by email. They can fill it out, and then actually we get notified when they do complete the scope of appointment. So that's it's a really good tool. A lot of agents use it who maybe have clients that are an hour or two away, and you need to kind of get it out there. Thank God we are no longer in the days where you have to fill out a scope of appointment 48 hours before the sale. Now we can do it the same day. So if you have one in paper, that's fine. It's not a big deal. Get it filled out. We do have an enrollments team here that you can fax and send secure emails through. So if you do have that paper scope, just send it in and say the enrollment was completed on our Connect for Medicare website, and then we'll make sure everything gets over there. You can also send an email, or you can send an electronic scope of appointment. And then if you needed to take the application on paper, you can do that as well. Just when you submit it through us, say that you got the scope of appointment through Connect for Medicare portal. Again, it will notify you when they completed the scope of appointment. And then also, if you have someone who says you didn't get the notification, but your client's saying they actually did fill it out, you can pull it up back in your dashboard and see what they have done or what they haven't done, and you can kind of explain to them what they need to do, or what else they need to do to complete it. Definitely email this to yourself, this and what the application and enrollment details will look like. If you are sending it by email, send it to yourself first, not necessarily every single time, but just do a mock kind of quote and send it to yourself so you know what it's looking like, and you can explain to your client what they're going to be looking for. So someone has a question if we can get the scope of appointments at Pinnacle. So we could send you out a PDF of a generic scope of appointment. It doesn't matter. I know some carriers will give you a certain scope of appointment to fill out, but it's a CMS rule that all carriers have to accept all forms of a scope of appointment. So you can send out, I'll repeat it again, so you can send out the scope of appointment electronically through this portal here, and then you can take a paper application. And if you're submitting the application, we prefer that you submit it through the enrollments team that way, just so it'll be easier for us to notify the carrier. And you submit the paper out to us and just say, hey, I got the scope of appointment done through through my Connect for Medicare portal. So just it's on there to send to the carrier. And vice versa, if you do the enrollment online here, you can just hit continue and skip over the scope of appointment and submit the online enrollment, and then fax us in your scope of appointment and just say that you did the enrollment via Connect for Medicare and you took a paper scope of appointment. So that's fine. We can make sure everything goes through on that end. So some of your health questions, it'll have the zip code, age range, and health status. So good, fair, and poor. Instead of trying to guess which one's which, if you hover your mouse over this little question mark, good means you see healthcare providers only for preventative needs or an occasional problem. Fair is you see healthcare providers for one chronic or multiple health issues. And poor is you see healthcare providers for more than one chronic condition or may need an occasional major procedure. At the bottom of that, it says this information does not affect your plan premium. It is used to calculate a more accurate estimate of cost with each available plan. So that'll give you kind of the breakdown. I'm not going to go over the client-facing portal, but basically when it'll spell all that out, you won't have to hover your mouse over a question mark, or your client won't have to get that information. And moving on. Next is the subsidy. So this is going to be some of those dual SNP plans I briefly mentioned, or if you're on Medicaid, you can kind of fill in some of these. We'll just put we're not eligible for it. Actually, you know what? We'll just put it on there. We'll say we're receiving Medicaid as well as Medicare, so the dual SNP plans will pop up for us as well on the portal. So drug list. So this is just like Medicare.gov. You got to put in their list of drugs. You can kind of enter that in. I'm just going to do lovastatin. We'll do 40 milligrams, 30 per month, and we'll just leave it at one drug. The beauty about using this platform, especially if you're saving the client's profile in, is I don't know if you've ran Medicare.gov quotes before, but I've done it before for help agents out and put in 20 drugs, and then something happens where there's a hiccup in the process, and then we don't and then you don't write them, or you have to run the quote again 2 weeks later. You got to enter in all of those drugs again. This will actually save all the drugs and all the information you put on here. So one, it's good if you put in 20 drugs, run the quote, and then they decide a month later, they want to actually enroll in the plan, and they change their mind at the time. Then you can wait till next month, pull up the information, and it'll have all the drugs saved. Another reason this is really big is because if you enroll your client, say this year, and then next year, it's time again AEP to kind of reevaluate the case. You can pull up the profile, all their saved information will be in there. Just change if anything has changed from this past year with their health or with their drugs. Update it in there, and it'll be a lot quicker to run these quotes, and it'll help a lot when you get a new plan that's competitive in the area to come in. So here we'll actually just select CVS. Unlike Medicare.gov, this only lets you do one comparison pharmacy with mail order. It'll always compare it with mail order, but unfortunately, you can only do one pharmacy. Select one pharmacy at a time. And as this loads for me, love the office Wi-Fi in here is acting super fast, as you can tell. And I'll kind of share a little backstory while this is loading. So one of our most successful agents who use this platform, what she'll do is actually she'll pull up a laptop, right? And she'll be entering in all this information just like we are on the laptop. But then she'll actually go and take a monitor, like a computer monitor, and face it at the client and plug it into her computer so she shares her screen so the client kind of sees all this information she's putting in, and it just kind of gets them on the same page a lot easier. And so they're not doesn't want your client to feel like anything's being hidden from them, so you can do it all right here. And now it finally loaded. So as you can see in the tabs, they have all the different plans: MAPD plans, Medicare Advantage with prescription drug coverage, prescription drug plan, standalone drug plan, PDP, whatever you want to call it. And lastly is just, or I shouldn't say lastly, but just the Medicare Advantage plans. These are the Medicare Advantage plans with no drug coverage. So don't get these two confused, okay? And then you have MedSup plans over there. But as you can see, based off of the drugs that we put in and the good health status, it will tell you what the cheapest plan will be. Also keep in mind, we checked off the Medicaid was we qualify for Medicaid, so it'll pop up the SNP plans here. So in the parentheses, it'll say this is a dual special needs plan. So this is going to be $201 is your estimated cost for the year, $0 premium, and it's a 4-star plan. Say you're looking to enroll somebody who's not actually on a SNP plan. So you can see it's a little bit more expensive, but it looks like on this Humana plan, they're going to be paying $884 for the year. But that is the cheapest, and we actually can do a little comparison. So we'll do two plans that aren't actually dual special needs plan or any type of special needs plan, and we'll do a little side-by-side comparison. So to give you the breakdown, estimated drug costs, it looks like on the Humana plan, they're paying only $36 a year for drugs, where on this Aetna plan, I'm sorry, this is the Advantage plan. It's $0. But as you can see, the estimated medical costs are $848 per year and $998. So if you really want to, you can go through and scroll down and kind of see where where those guesstimates come out from. It is a guess though, like I said, if something happens with them medically and they have to pay more out of pocket, they can't really predict the future here. The only exact number that they're going to give you is really the drug. So I pay the most attention to the drug cost. Because if you go to CVS for the entire year, that's what your payments will be. But what we can actually do is switch it to mail order and see if it's going to differ the price at all. So here's kind of a breakdown, and we're going to get to this. You can actually do the doctor lookup right here as well, but we can do see the drug estimate by month, and you can see you're paying about $3 a month basically. But if we switch to mail order, you actually will pay nothing. So you'll save them $36. So always click into view details and look at the mail order and see if you're going to potentially save your clients any money. And then the last step here I'm just going to show is how you can do a doctor lookup, and then I'll just show you really the enrollment side of it. So this just brings you to the Humana site. If you ever ran a doctor lookup before, you put in the zip code, what type of plan, and then you just look at the doctor. And if they pop up, they're in network, and then you just enter in the code. But from here, you can send everything over. You can send the scope, and you can also send, we saw before, you can send all this information, summary benefits, plan star rating, the Spanish version of that, evidence of coverage, notice of non-discrimination, and multi-language insert. So basically everything that you have to provide your agent, I keep saying agent, I'm sorry, everything you need to provide your client with, you can include on here and just send it via email. And again, send this to yourself first just so you know what it's looking like. It'll come over in two separate emails that are about 2 seconds apart. It'll send them this, and then it'll send them the verification code just to make sure they're getting in, and obviously it was sent to the right person. So they just have to hit continue. Once they get the original email with the plans, and then they open up the second email and get the code, and they can just type that in. So we'll X out of that, and then enrollment. So if you're with them in the house, or if they're in your office and you want to enroll them, just hit enroll, hit next, and then all that information we entered in when we made the profile will auto-populate here. As you can see, the home phone number is all zeros like I put in, the email auto-populates, and then the address auto-populates. So basically it's just an e-app from here on out, and then you submit it, and it doesn't take any longer than it would be if, so it looks like Humana's site, but you're actually still in Connect for Medicare. Nothing changes in terms of how quick it gets to the carrier. It'll get there as soon as you hit submit, so you don't have to worry about any of that. And then if you need us to do any plan follow-up or application follow-ups, or commission, anything on commission with the plans, and then if you're on agency block, which is our CRM system, we will update anything through our enrollments team. So secure email, paper app that you fax into us, or if you do it through our Connect for Medicare, we will load all that into our CRM and keep you updated on there. So you can always log in and just check all your clients' application statuses, and you won't have to log into Aetna and Humana and Cigna. It'll all be in the same place as long as those carriers are contracted under us. So that pretty much about does it for this webinar. If you have any other questions, type it in. I'll be more than happy to answer them. But like I said, that kind of wraps it up for all the for all the information I had to cover. I know it was a lot. I know I might have flew through some things. But if you have any other questions, let us know. Okay, so perfect. William, I saw you asked a question probably about 10 minutes or so, got a little bit ahead of me. I didn't see it. He was asking if can a manually submitted application be tracked from this site. So yeah, we can track it. We actually have the information in-house. So if you just give us a name, we can call on it. Whereas if it's something you submit direct to the carrier, you just got to give us Medicare number, Part A and B effective dates, and the client's name, and then we can basically call on it. But if it's in-house, we're able to follow up on it a lot easier. So I'll leave the questions open a little bit longer. I'll give you guys maybe 3 minutes more or so, and type of way. If you have any other questions, I'll answer them, or if you want me to kind of ask them directly, I can do those as well. All right, Claire, I see you have a question on how to log into the website. So for the Connect for Medicare website that we just went over, you basically get a login for that. I'm not sure if you're contracted with this or not, but basically, if you once you're ready to sell for each of the Medicare Advantage, PDP, or Med Sup carriers, once you get your first writing number, then you will become active, and you'll get your login. And then as each of the carriers become ready to sell, you have to wait 24 hours from when you're officially ready to sell, and then those will show up on your Connect Medicare platform. And then for the PFS insurance website, where we did the CSG quoting software, and you can see some of our webinars, once you contract, you'll immediately get a login. If you need the generic login this week, the username is agent, all lowercase agent, then the number 1, so agent 1, and the password is, I believe, agent and then 34, all lowercase, no spaces, agent 34. I'll stay on here for a couple minutes more if anyone has any other questions. Hey, Oscar, yes, this is a recorded webinar. So I think we're going to close it up now. So if you guys have any other questions, anything like that, feel free to email or call in, and we'd be more than happy to help you out. So thank you for everyone for getting on. And let me make sure. Got one more question? No, sorry. Okay, got them all. All right, thanks everyone for logging on.